Hi, today we're talking about colds and flu. I'm talking with Dr. Tom from NaturalNet. Dr. Tom, when I get a cold or the flu, I feel absolutely awful, but I've been told that it's really important to have a cold or the flu at least once a year. Is that true?
It is definitely true that when you have the signs and symptoms of a cold or flu, your nose is congested or your throat is sore and you may have a fever, hopefully you actually have a fever. You don't have any energy, you don't want to eat anything, and it's like, oh gee, what is the body telling us? So the body is telling us that it's overwhelmed. It's an indication that we probably have been doing too many things or not the right things leading up to that period of time. Maybe we haven't been sleeping enough, or our diet has been off a little bit, or we've been working more at work and our stress levels have been higher. So it makes us more susceptible because our immune systems are not exactly totally tuned up. So in reality, it is a good thing to get a cold or a flu. The challenge with getting a cold or a flu then is, of course, then not to basically try and totally suppress the symptoms, which is making you feel poorly. So we really need to, turn off our cell phone and not go to work and basically stay in bed and do what Mom said, is eat chicken soup and drink lots of water.
Right.
Because it is the tune-up that you need on an annual basis. And I often will tell patients that if you don't get a cold or a flu on a, annual basis, it's sort of like never tuning your car up. The car would run, but we wouldn't even realize that the gas mileage would be going down, and we just wonder why, we wouldn't be going as far with the same amount of gas in the tank. And the same thing happens to our body. We tend to become more sluggish. We don't realize that. So our immune system needs at least an annual tune-up. And the best way to get that tune-up is to make it work. And to make it work is to get a cold or a flu. And, of course, there are some people that who have other underlying conditions that need to be monitored much more closely. But for the average general person to get a cold or a flu and have a fever, it's definitely not a bad thing. And potentially one of the things you shouldn't do is to try and reduce your fever. Taking Tylenol because you're achy and all that is not in the best interest, because what you'll eventually do is just prolong the internal imbalance that goes on. And if you basically just go to bed and eat lightly and do some hydrotherapy type treatments, you'll get over it much more quickly, and your body will be right back in tune where you need it to be, ready for the next aspect that's going to be affecting you. So, yes, it is true that you want to get a cold and a flu every year.
Okay, good to know. Thanks, Dr. Tom.
You're welcome.